Hello everyone, I am Dr. Wassef Khaled, musculoskeletal radiologist at the Leonardo da Vinci Imaging Center in Paris. On behalf of the entire team, I am pleased to present these self-learning videos on ultrasound of the fingers under the patronage of SIMS. I would like to thank Canon for its logistical and organizational support throughout the development of these videos and for its ongoing partnership. After a brief introduction where I will demonstrate the correct positioning for performing a finger ultrasound, we will successively present 4 videos. Dr. Elodie Sibilleux will cover the joint structures, ligaments and the palmar plate. Dr. Quentin Monzani will focus on the palmar surface of the fingers, the flexor tendons and the pulley system. I will then cover the dorsal surface of the fingers, including the extensor tendons. Finally, Dr. Gabriel Kojas will cover the area around the metacarpophalangeal joint of the thumb. To perform a proper finger ultrasound, it is essential to position yourself comfortably, with both the patient and operator sitting face to face. The patient's hands should be resting on a tablet at an optimal height, and the foot pedals should be within easy reach to keep the hands free for performing dynamic maneuvers. It is also helpful to have a tube of ultrasound gel on hand, as this can assist in positioning the patient for certain dynamic maneuvers or when accessing difficult-to-reach structures, such as the metacarpophalangeal joint of the thumb, or when performing dynamic assessments of the extensor or flexor tendons. The ultrasound examination will begin with a brief interview to clarify the patient's symptoms and to pinpoint the exact location of their pain. Efforts should be made to uncover any potential traumatic events, even if they seem minor or trivial to the patient, as certain ultrasound findings are interpreted in light of this context. Following the interview, an inspection phase is crucial to identify any characteristic deformities, which will help direct the focus towards specific anatomical areas for examination. For example, a boutonniere deformity of a finger requires evaluation of the central slip of the extensor tendon, collateral ligaments, and the palmar plate. In contrast, a mallet finger deformity necessitates focusing on a terminal slip of the extensor tendon, while a bowstring deformity requires assessment of the A2, A3, and A4 pulleys. A trigger finger, as demonstrated here, calls for the examination of the A1 pulley and the flexor tendon, while an extensor tendon dislocation in the intermetacarpal valley demands evaluation of the sagittal slip. A palpation phase is essential to assess joint range of motion and identify areas of tenderness. The examination should be thorough and methodical, even when guided by specific findings and at the end of the exam. It is crucial to ask the patient to once again point out any painful areas and symptoms to ensure nothing is overlooked. A high-end ultrasound machine is essential, equipped with high-frequency linear probes, 18 MHz and 24 MHz, with at least an 18 MHz probe, as well as a golf club probe for manoeuvring around bony prominences. With that, we are ready to begin our overview of finger ultrasound. Enjoy the presentation.